Brain hemorrhage is a serious condition where a blood vessel inside the brain bursts, causing bleeding within the brain. This bleeding can happen either in the brain tissues themselves or in the protective covering around the brain. This protective covering is known as the meninges, and it is made up of 3 distinct layers. The middle layer of these 3 layers is referred to as the arachnoid mater. This layer is rich in blood vessels, meaning many vessels run through it. As a result, the blood vessels found in this layer can burst. Consequently, blood begins to leak and gather in this layer. Bleeding can occur either in the brain tissues or in the aconite matter. Both types of bleeding cause harm to the brain. If bleeding happens in the brain tissues, then brain cells begin to die due to a deficiency of oxygen in this situation. And if the bleeding occurs within the brain's covering, in this scenario, the brain's covering begins to loosen because of the blood accumulation. This accumulation results in pressure being exerted on the brain cells located inside. And due to this pressure, the brain cells in that specific region start to die. There can be numerous reasons for bleeding in the brain, such as a severe head injury, rupture of a brain vein due to high blood pressure, the presence of a tumor in the brain, or the patient having any kind of bleeding disorder, among others. If we discuss the symptoms of brain hemorrhage, then when a person suffers from a brain hemorrhage, they begin to experience intense pain in their head, and vomiting might occur as well. In addition to these symptoms, the patient may also find it increasingly difficult to see clearly and to speak properly. Moreover, their body coordination tends to deteriorate rapidly. If someone is exhibiting all of these symptoms, it is crucial to take them to a doctor without any delay. This is because even the slightest delay in treating a brain hemorrhage can lead to severe consequences, including the possibility of death for the patient. To treat brain hemorrhage, doctors need to know where the bleeding is and the damage extent. They use a CT scan or MRI. Once identified, treatment begins. Surgery often involves opening the skull to drain the blood clot. After the treatment, if the patient experiences any physical abnormalities like difficulty in walking or speaking, then physical therapy and speech therapy are conducted to address these issues. As a result, the patient soon becomes more alert and begins to perform his daily activities properly and efficiently. Thank you for your question.